Hey, it's Friday. It's TGIF Doc Talk with Dr. Go.
Hi everyone, and welcome to another episode of Doc Talk. And today we are going to talk about hypertension, also known as high blood pressure, especially in the senior citizens. We'll try to make today's podcast not too heavy in terms of the scientific jargons, and we'll try to talk about more common things. So I won't be talking about the scientific basis of why elderly people are more prone to develop high blood pressure. I won't be talking about medication or treatments. I'll talk about more useful things like very simply, why are senior citizens face much more difficulties in controlling their blood pressure as compared to a younger individual. I will also talk about what are the non-pharmaceutical approaches to help to control the blood pressure. And also we will dive into a little bit on what are the main concerns of blood pressure management for senior citizens. Now, put it in a very nutshell, in a one sentence, why is high blood pressure more predominant and difficult to control in an elderly person? Now, as an elderly person starts to age, their arteries becomes much less elastic, and it results in a increase in their systolic blood pressure. Elastic in a sense whereby usually when the blood is pumped out of the heart, so the vessels, when they are more elastic, they can expand, they can contract, and when they are more elastic, the blood pressure typically is less high because the pressure is spread out more evenly. Now, as you grow older, the arteries becomes more rigid, it becomes less elastic. There's also the other factors of baroreceptors, which is the sensors of your body, which detects the pressure readings. It may be a bit off. Various factors, life, stresses throughout the past many decades of life, all of these come to play, which causes high blood pressure in the elderly citizens. Now, why is it much more difficult to control for an elderly person is because senior citizens often have multiple diseases. So they might have diabetes, they might have kidney disease, they might have heart failure, and there's only a handful of categories of blood pressure medications that we have. And let's say one category is contraindicated in patients with kidney failure. So you only have 3 left. And if out of those 3, 2 doesn't work for you, then you have 1 left. So those kind of circumstances which makes the blood pressure control much more difficult in the elderly population. I would share what are the typical advices that I would give to an elderly person to help control their blood pressure in a non-pharmaceutical way. Now, it doesn't mean that they don't have to take their medications. The medication still needs to be taken, but it's very important to supplement these other approaches in addition to the medicine that they take. Now, the thing that I find most important is actually weight control. Your body being very heavy in weight, it actually makes blood pressure reduction extremely difficult. So weight management is the number one, in my opinion, to solve. So if you're obese, one of the most important things to do is to actually cut down on your weight, and you might find that the effect of medication would amplify significantly. The second main thing is to change your diet. So don't take too much high sodium food. So if you are somebody who really likes very salty food, you need to change your lifestyle to adapt to more bland tasting food. So less salt, less soya sauce, less canned food. So try to reduce the salt intake as much as possible. And number 3 is, of course, everyone talks about regular physical activity, but it goes hand in hand with increasing the elasticity of your vessels and also helps with weight management. And last but not least, which is something that I find very consistent with the elderly patients that I see, is stress. So stress reduction is very important. Very often we will see the typical scenario is when the elderly person suddenly has additional responsibilities of taking care of the grandchildren, for example, during the daytime or during the nighttime. And children are hyperactive bunch, right? So very often this would contribute towards, if it's 1 or 2 days, it's fine, but long term wise, it may be very detrimental to the health of the elderly because they're on constant stress. Children are always very excited, and this kind of excitement should not be matched with an elderly person's lifestyle. And also sometimes stress between elderly couples. So it's very important to be very understanding between both individuals so that you are able to reduce the stress between elderly couples, and also to have very good sleep. So those are the non-pharmaceutical approaches that I would suggest to help reduce blood pressure. If you find that with certain medications or with a whole bunch of medications and your blood pressure is still high, it's really high time to really consider the lifestyle changes. Now, what are the usual main concerns of high blood pressure management in senior citizens? The main concern is what we call orthostatic hypotension. So, blood pressure medications serve to suppress the blood pressure in a way, and sometimes when an elderly person gets up from a lying position immediately to a seated position, with the effects of medication, their blood pressure may drop very rapidly, and this may cause a very sudden dizziness or vertigo-like feel. They just get so dizzy and they fall, and this may lead to other injuries like fractures or concussion. So the main thing is about orthostatic hypotension. So the blood pressure suddenly drops too low. So usually for senior citizens without any other health issues, if they actually had experienced this kind of episodes, we typically tend to advise to come up from a lying position to a seated position slowly so that the body can adapt to the blood pressure changes. And also typically it will be more advisable to keep the blood pressure not too low, meaning to say we usually do not aim for the ideals. We have a little bit of maybe a bit of a buffer of about 10 millimeter mercury, a little bit higher than an acceptable level, slightly higher, just to avoid too low of a blood pressure. For elderly people who have inconsistent diets or inconsistent appetites, or may be dependent to others to feed them, usually electrolyte imbalances is what we are concerned about. So certain high blood pressure medications like thiazide diuretics, loop diuretics, for example, they might cause low sodium, and if this person can't really voice out what are they feeling, by the time you detect it, it may actually they might actually just lose consciousness, or it might cause heart rhythm abnormalities or just extreme weakness. And also one of the main other issue is having high blood pressure with concurrent dementia. So the issue here, there's two. One is they forget to take, and the other one is they take and they forgot they took and they take again. So double dose, or maybe triple dose. So these are the things that makes the whole compliance side of things very challenging. And of course, there are other ways like using a pill box or having somebody to manage their medications in a nursing home or in the daycare. So these are the various approaches that we can actually help to reduce the risk of over or under medication. So all in all, this is a very simple introduction about hypertension in senior citizens. So yeah, happy to hear if you have any other topics that you want to talk to know about. Happy to share. So thanks for listening, and goodbye.
Click the share button to share this episode to a friend or a caregiver and hit follow to keep up with our latest episodes. Thank you.